Okay. So thanks so much for attending today and for Linda and I to have the opportunity to share the work, not only our work, obviously the work of many people in the task force and also our external advisory panel, but really the task force is the culmination of over a decade of activism, advocacy, championing of the agenda of chronic pain in Canada by literally thousands of people with lived experience, clinicians, family members, policymakers, and others. And as those of us know that have been in this, it has not been an easily won thing to get to this point. So Linda and I wanted to share a bit today about the latest report from the task force, an action plan for pain in Canada, and have an opportunity to dialogue with all of you about what this means. So I'm going to run through some slides. Linda's going to take the helm, and then I'm going to sum up and we'll have an opportunity for questions. So Linda, maybe do you want to just introduce yourself before, say anything more about yourself before we launch into the presentation?
Sure. Well, I live in New Brunswick. I have rheumatoid arthritis and I've had it for 40 years. So the result of many years of treatments that didn't work, I've left with chronic pain. I'm just a person with lived experience on the task force. I also have my own organization that I'm president of, Canadian Arthritis Patient Alliance. And we've been around since about 2002. And I have just a wonderful network of colleagues across the country. And I'll just leave it at that for now.
Awesome. Thanks, Linda. So just to recap a little bit about how we got here. So many countries who have been experiencing issues related to opioid overdose deaths have recognized pain as an issue. We would have loved that pain would be recognized as its own problem before it being recognized as a result of the overdose crisis, but that was not really the case. We really started to see governments take action on pain really as a result of issues related to opioids. Many of us have been working on this issue since, 2009, 2010, things really started to move forward with a broader coalition. There were organizations like the Canadian Pain Coalition, the Canadian Pain Society, and other patient advocacy groups who were very involved in calling for action on the issue of pain. And in 2018, there was sort of this tipping point moment where the federal government was convening many stakeholders for what's called a ministerial roundtable. There was the summit, and then they said, the minister wants to meet with pain stakeholders. And this was the first time where there was really an open door for that conversation. And that meeting was held in the late fall, I think November, if I'm remembering right, of 2018. And very shortly after, maybe it was September, and then very shortly after that, the task force was announced in March of 2019. So, to me, nothing ever feels fast enough, but when you're working with the federal government, having something committed to in late 2018 and announced in early 2019 is actually rapid fire. So the task force was established. It's a group of 8 people on the task force itself, and then an additional group of 16 who form our external advisory panel. The people on this map in purple are task force members. The people in blue are members of the expert advisory panel. And this is really a broad group, people who live with pain, or also people who have lived experience, maybe their family members or other loved ones, Indigenous peoples, researchers, clinicians, educators, etc. Lots of different disciplines, so physicians, nurses, physiotherapists, psychologists, etc. We are also supported by a Health Canada Secretariat. So this is a group of staff within the government that are mandated to kind of push the agenda forward from within. And then there are two other groups that we've been working with. One is the Federal, Provincial, and Territorial Working Group on Pain. So these are government representatives from each of the provinces and territories, usually senior policy people from ministries of health. They've been coming together to share what they're doing and trying to advance some common projects. And then there's also a federal government interdepartmental working group on pain. So these are people from across federal departments, all of the areas that the federal government works in that actually either could impact pain or are touched by pain. So things like Veterans Affairs Canada, Correctional Services of Canada, Indigenous Services Canada, Employment and Social Development Canada, a public health agency, the people who regulate drugs in our country. This is a very broad group. I think there are about a dozen federal departments that are represented at that table. So as you can see, a lot of engagement. And for those of us like Linda and I, we're very used to advocating from the community to government. And this is really the first time that we've had a kind of critical mass of people within government that are listening, that are attuned to the issue of pain, learning, and trying to take action. So a little bit about sort of how this started and what we were asked to do. We were given 3 years, which I tell you at the beginning, Linda and I and many others had conversations about this is too much time, this is urgent, we need to speed this up and do more and more quickly. But what we were asked to do was take this time to study things and make recommendations. The first was to assess how chronic pain is addressed in Canada. We did that, and we published our first report in June. So we started in March, first report in June. Then we talked to many people across the country. Lots of people with lived experience shared their stories. And we did evidence reviews, really dug into what are the best practices that are going to make a difference on this issue. And we published our second report with a lot of delays because of COVID late in the fall in November. Initially, we were not asked to make specific policy recommendations to government. But once that second report was in, we had done so much work to bring government along to really recognizing the urgency of this. And I think the ongoing overdose crisis and COVID really helped to drive that. And when the minister saw this second report, there was an immediate response to strengthen the mandate of the task force and say, you know, we don't want you to do something sort of vague and general. We want you to actually provide specific policy recommendations to ensure that pain is recognized and supported, and that we're really doing our best to understand, prevent, and treat pain in Canada. So we were given an empowered mandate. The minister asked for that report on a very accelerated timeline. So the report went in November. She said, I want an action plan by the end of March. And we were able to deliver that. It was publicly released at the beginning of May. And the task force is staying in place until the end of our full mandate, which is December of this year. So I'm not going to dwell on this slide. This really sums up, you know, what we know from our work is that there's increased recognition that chronic pain is a disease in its own right. This idea in the past that, you know, chronic pain was only a symptom of something else, or that it was a fiction that people were making up, or that it was something people were using to get out of work. You know, all of that, we're done with that way of thinking. And this is really validating that chronic pain is a disease in its own right. We know that 8 million people roughly live with pain in Canada, but that the burden of pain is not evenly shared. So we see greater rates of pain and greater barriers to care among certain populations, and some of those are listed here. We did some very detailed costing work. So we engaged a team within Health Canada that really looks at data and really digs into, what do things actually cost our system? And we know that chronic pain has a massive economic impact. From 2019, the data is around $40 billion. We also know that there's a lot of things that we could do. If we were appropriately assessing and treating pain early on, we can reduce its impacts. And there's the potential to invest in that and see big savings down the line, but also just better outcomes for people's lives. We know that issues of unmanaged pain are really a huge driver of the overdose crisis. We also know that this pendulum swing around opioid prescribing has really had a lot of unintended, extremely negative consequences for people who live with pain. So we've seen suicides, we've seen people turn to the illicit market for relief. We've seen people who live with pain feel stigmatized and criminalized. We need to do something about that. So we know COVID has made things much worse. People have been delayed for surgery, not able to access the kinds of supports that they normally would to maintain their quality of life. But COVID has also really driven the system towards massive transformation. So we're seeing all across, not just the health system, but the economy, all kinds of things are being looked at differently because of COVID. And we want to insert pain into this moment of massive transformation. So Linda, I'm going to hand it off to you, I think, to talk about the goals that are outlined in the plan. And
yeah. Okay, I'm going to go through the action plan and the 6 goals. It was really exciting to see this work get actually distilled into a manageable format that is easy to understand and very pragmatic, I think. So there were 6 goals that the action plan came across. One was to enable coordination, collaboration, and leadership across Canada. There is so much going on, and there's such a momentum that has been building that we need to really harness that and collaborate and try to everybody work together, because where we started, in 2010 to where we are now, it's just we're light years ahead. To improve access to timely and equitable and person-centered pain care, to increase awareness, education, and specialized training for pain. And we've seen a lot of this already begun. We've seen some of the training started. We've seen some of the education happening within government. To support pain research and strengthen the related infrastructure. And we've seen that as well happening, but we need more of it. Also to monitor population health and health system quality. There hasn't been a lot of monitoring what's going on in the pain community, and we need to do that. Also to ensure equitable approaches for populations who are disproportionately impacted by pain. Maria talked about that, the Indigenous people, sexual and gender, and all women and just people with disabilities. So we need to try to make that a more equitable approach. Next slide. So this is some of the federal policy levers, and Maria talked a little bit about some of the things that have been going on in the background. So some of the federal levers that we can use to get this action plan done. Policy development and advice, and that's about best practices, standards and guidelines, pan-Canadian strategies, international, but looking at what's going on international, like in Australia. Communication, and we're seeing some of that come with social marketing, guides and toolkits and consensus building. The prioritized pain campaign that came out with the 3rd report, and there's the monumental effort that's been going on over the last few weeks to try to get some action and get this report out there. Legislative and regulation development, amendment, enforcement. And we've seen that with COVID-19, where very quickly opioid prescriptions were able to be refilled virtually, as opposed to exposing people to COVID by having to go into the office, as well as through some of the national regulatory that we've worked with the committees around opioid guidelines and prescribing, and the input of people with lived experience into some of those guidelines. Also, program and service delivery and direct program delivery, grants and contributions. Machinery, arms lengths, our networks that we have, the Canadian Pain Care Forum, and the federal, provincial, territorial committees, the partnerships that have been built in the last couple of years with this pain task force. And then the fiscal instruments that the government can use, transfers to provinces and territories, individuals, and tax incentives. Knowledge development, surveillance, and monitoring. So the research funding, internal research and surveillance and monitoring. All these are policy levers that we're going to need to use to implement the action plan that we put forward. Next slide. So the action plan for pain is coordination. Goal number 1, pain is recognized as a public health priority in coordination across jurisdictions, spurs collaboration, leadership, and support to ensure a consistent approach to pain throughout Canada. Some of the recommendations are working together and coordinating action across the country. We've seen that. We know there's so much going on in different pockets across the country. If we can coordinate that and amplify that, I think we'll really have made some actions and difference. Inclusion of chronic pain in federal, provincial, and territorial funding programs. Pan-Canadian health organizations helping to scale best practices. And we've already seen some of this work with CADIS coming out with toolkits and different things. You know, this has been pain's been getting attention. Provinces and territories developing pain strategies and actions. And we've seen that happening in Nova Scotia, Alberta, across the country, and the provinces, you know, are working together. Maria and Fiona have presented to the provinces about chronic pain and the work of the task force. Also evaluating and reporting on what's been done. I don't think we've done a lot of that in the past. Next slide. And goal number 2, access and education. People have equitable and consistent access to a continuum of timely evidence, informed and person-centered pain care supports across jurisdictions. Some of the recommendations involve improvements to the rules guiding the healthcare system in pain care, investments in pain-related services to meet individual patient needs, and I've heard a lot about the hub and spoke model, standards and guidance across the country, and supports for more virtual treatment, self-management, and peer supports. And this is where people with lived experience can really come in. And I know for myself, for CAPA, we've been working a lot on the virtual care and what that means for patients. And we've been working with the Canadian Rheumatology Association on developing best practice statements for virtual care. Goal number 3, people living with pain and health professionals have the knowledge and skills and educational supports to assess and manage pain based on population needs. The broader community understands pain as a legitimate condition, reducing stigma. And Maria again alluded to this, where people are not making up that they're in pain. This is a serious, and needs to be acknowledged as a serious disease. Public education and awareness is needed. The ability of the health system to build pain knowledge among people delivering care. And this has already started with the ECHO program, and we've seen, you know, some really great programming coming out to deliver training. Also in the medical school curriculum. Training and development for health professionals during their schooling and once in practice. So we've also seen this started, and I remember when I first got involved in the work around pain in 2009, whatever. I mean, we, you know, at that time, veterinarians received more education around pain than our doctors did. So we needed to see this action. Next slide. And goal number 4, pain research and related infrastructure enables discovery and innovation, resulting in the translation of knowledge into real world impact. And this is where we really need to engage with people living with pain. And we've seen that through the Chronic Pain Network and the Veterans Network. Coordinated and dedicated research for pain in Canada, where researchers work together to build knowledge and they talk to each other. Systems and tools that support research enable tailoring care to particular needs. And then also our trainees, we need to build the next generation of pain researchers. And then goal number 5 is data enables effective monitoring of pain and facilitates improvement of health system quality. And this is just about national indicators and healthcare systems talking to each other, reporting on how many people live with pain and their needs, building more information on what helps to improve pain and what makes it worse, and increase information on who is more likely to be impacted by chronic pain and what can we do about it. And then goal number 6 is equity. There is improved and equitable access to services for populations disproportionately impacted by pain. We've talked a bit about that. First Nations, Inuit, Métis people, racialized people, people who use substance people with mental illness, workers, disabilities, children and youth, seniors, women, people who are sexually and gender diverse, people who are incarcerated, and veterans. All of these populations are disproportionately affected by pain. So some of the recommendations involve access, availability, and quality of service delivery, flexible benefits and support systems, national standards related to different populations, helping people move through the health system and different types of services, especially when they're moving between different care settings. An example could be hospital to home. Education and training around challenges and needs of different populations, and research and the collection of information. So I'm going to let Maria take it back to close out with the next steps.
Thanks, Linda. So when the task force created the action plan, there's a lot in there. The action plan includes over 150 specific recommendations around all of these goals. And we very purposely did not prioritize the recommendations in the report. So often in these types of processes, if you say to government, these are our top 10 that you have to do now, if government doesn't see an easy way to do that, that's where you see these types of reports just sit on a shelf. And so we didn't want to put ourselves in that situation. That said, we did meet with senior people within Health Canada, including the minister and others, and really outlined the things that we think are very doable and very important to tackle now. So one of the things that we really wanted to see was a similar process to bring people together. So not all of this can be done by the federal government. Lots and lots of this needs to be done by provinces, by territories, by people with lived experience and organizations, grassroots kinds of initiatives, universities, hospitals, lots and lots of partners. And what we saw around the issues related to opioids was the federal government worked as a convener, and they brought everybody together. They held these big national summits, and they said, we want those people who have a role to play to make a commitment to action. And people did. Organizations stepped up and made all kinds of commitments and carried forward all kinds of projects. We think there needs to be a similar type of process to work on pain. We also want some financial resources to move quickly towards community-based pain initiatives. One of the things that we raised with the federal government is that pain is not like other chronic diseases where you see a considerable amount of sort of grassroots organizations or things going on the ground that you can build on. So if you think about arthritis or mental health or substance use, I'm not saying that there are adequate resources for those, but there are lots of different groups that have gotten established and could be called on to take action. In the pain space, it's still very much in its infancy. So there are really not a ton of community-based groups. What we have a lot of in Canada is awesome pain researchers, but not a lot of for example, very established advocacy organizations or other. They're starting to come online, and we're seeing incredible successes. Health Alberta's Pain is a great example of an organization that has gotten going in the last number of years and has already demonstrated some real successes with policy change in their province. CAPA has been doing great work nationally, being a voice for people who live with arthritis, and there are some others, but pain-specific organizations still few and far between. We asked the minister to really take a bold stand around the issues of discrimination and denials of care to people who live with pain and require opioids for pain control. So we've seen this, even though there've been some efforts made to change policy or guidelines, the practice of people not being able to get access to opioids when they need them still exists. And this story of people who have a family doctor who moves or who retires and they cannot get access to anyone to prescribe for them, this is an ongoing problem, and we're very worried about it and want the government to take more action there. The need to raise awareness and combat stigma. I think many of us in the pain space, we're really glad to see the legitimizing of pain, but this is something that we need to spread broadly among the Canadian population, employers, schools, all of these kinds of settings, similar to how that's been done for mental health or other kinds of conditions. And it's really just changed the way people in the general public think about these conditions. So we'd like to implement the same kind of campaign around pain. There are many funding agencies that fund research in Canada. I think many people are familiar with the Canadian Institutes for Health Research or the Social Sciences Humanities Research Council or National Science and Engineering Research Council. These bodies give hundreds of millions of dollars to research, and we really want pain to be integrated across all of those groups as a priority. Lastly, we know that there's more to do. I mean, we've seen with COVID the power of governments to gather information, data, and communicate that to the public. And we want to turn on all of that machinery to gather better data around pain. And these are things that we think are low-hanging fruit that we could be moving on quickly. So when we think about tackling pain in Canada, we want to take an approach similar to what we've seen with COVID. So we call this a whole of society approach, or some people call it a whole of government approach. But recognizing that complex problems need lots of different people working on them, lots of different solutions. There's not one thing that's going to solve the issue of pain in Canada. So we need governments, we need NGOs, health professionals, people living with pain, employers, and many, many others working on this problem and working within their own spheres of influence, the things that they can do, but also coming together in a broader coalition. So what's next now that the action plan has been launched? So Health Canada is working with task force partners and others to promote awareness. So there's been all kinds of things that have happened both from the government side. So, there's now a government website on chronic pain that didn't exist before. Government's been pushing this out through like the Public Health Agency of Canada and the minister's social media accounts, those kinds of things, as well as presenting at relevant committees, stakeholder meetings through webinars like this and others. As the co-chair of the task force with Dr. Fiona Campbell, I've been presenting at a number of senior government tables, so presenting to the assistant deputy ministers across all the provinces and territories, those kind of groups that come together to plan for change in the healthcare system. So a lot of that work is underway, and a lot of it is being led by Health Canada or government, but a lot of it is bottom up, so driven by community organizations and others that are partners in this work. And the reason for that is because we know that when this type of group, like the task force, delivers a plan to government, if the government hears silence when that report is delivered, that's a clear message to them that the community really doesn't care a lot about this issue. If they see a lot of action on social media, a lot of people talking about it, a lot of people driving awareness of this work and calling for the implementation, that really matters. And that's when you start to see government really move on recommendations. So Pain BC took the lead just because we have some good infrastructure for this kind of thing. And we worked with the Solutions for Kids in Pain and the Quebec Pain Research Network and the AQDC, which is the pain patient organization in Quebec. So we worked with those folks to develop this campaign and launch it. It's been very successful. So we've had over 4.5 million social media impressions just in the last month. We've had over 550 organizations being engaged, 37 partners that are pushing it out through their own newsletters, their blogs. And these are groups like the Canadian Dental Association, the Canadian Physiotherapy Association, groups like CAPA that Linda is the leader of, and also groups that have not really been active in the pain space, like Moms Stop the Harm, which is a group of mothers who have lost their children to opioid overdose, many of whom had untreated pain. Or groups like the Canadian Building Trades Unions, which is the umbrella group for over 500,000 workers in construction across Canada. All of these groups that really haven't been involved with pain, but really we're reaching out to them and helping them see the relevance of this work, and they're definitely stepping up to move it forward. So next step, the task force is continuing on doing these kinds of things and all kinds of other supportive activities to move it forward. Within the federal government, there's a lot of work going on to explore, okay, how do we implement these things? So they're meeting with each other. They're looking at specific recommendations and saying, well, what would this cost and who would be involved and what would it take to bring this one to life? They're identifying people and saying, you know, this is for you to lead, that's for you to lead, or how are you going to integrate this into your current work plan? And really looking at what are the things that are short-term, easy to do, medium-term, and long-term. One of the things that we've been really excited about is conversations about potential funding flowing for community-based pain initiatives. And I think we're going to see that coming very soon, and very just really thrilled to see the recognition that, you know, pain is a priority and we need to put some resources behind it. So if you would like to reach out to the Secretariat, they have a painfully long email address that is here, as well as the website for the task force. I'm available through Pain BC, and you can find Linda through CAPA as well. But maybe we'll stop there and just open it up for some questions and discussion. So thank you for your attention. And we just look for your engagement as we move this forward. Linda, any final words from you?
No, I think you've covered it. So I'm happy to answer some questions.
Great. Jen, would you like me to exit my slides? Is that the best
Sure.
one?
I think so. And then if we get a request to go back to them, we can do. But thanks for that. That was really interesting and very clearly outlined contents of the report. So thank you. So just a reminder to everyone, if you do have a question, put it in the Q&A or the chat, and I will read it out. So we do have one question. So it's more of a comment, but I can imagine many people have this thought. So the comment is that it can be difficult for healthcare providers to appreciate the level of pain if they haven't lived with it themselves.
Yeah, maybe I'll start, because I think, you know, that could be same for anything, right? I mean, if you haven't had cancer, it's difficult to appreciate what that's like to live with. So, you know, I think that the healthcare professionals have a responsibility to learn more about pain and learn how to treat their patients with respect and dignity, and to, you know, do the best that they can, because there are, you know, we through the work of the task force, there's many ways, effective ways to treat pain. Opioids is just one small part of it. I mean, there's all physiotherapy, there's you know, multidisciplinary pain clinics. So these healthcare providers have a responsibility to learn and to have a will or want to continually educate themselves about new and best practices. And you know, that they don't understand it, they have a responsibility if they're a healthcare provider to try to understand.
I think the other thing that I would say, just to add to Linda's comments, is just, so much of the work that happens in silos. And I think some of the richest, most powerful work that I've had the privilege of being involved in has really brought together people with lived experience, clinicians. I mean, in the chronic pain network that Linda and I are both deeply involved in, it's researchers working with people with lived experience in partnership. Even things like, writing articles for publication together, writing guidelines together, developing educational materials together. And I think that is really, we're just seeing more and more of that. Whereas in the past, you would see, what we call patient advocacy groups working in their space and clinicians working in their space. And I think we really want to disrupt that whole model and have people with lived experience in every way and shape across everything that we're doing. And that's really been so much of the model that we're trying to work towards.
That's fantastic. And I've certainly seen just in the education work we do is certainly so much interest from healthcare providers in collaborating with people with lived experience. So that's, on the ground, it's very encouraging. Okay, thanks for that. So here's a question. So what do you think is something we can do to further the change? Where would we best put our energies? It's a good question.
We have lots of ideas, I think. So one of the things that we know is that sustaining the momentum is so important. So, we wanted to make a lot of noise when the report was first published, but we want to continue to make a lot of noise. So when we launched this Prioritize Pain campaign, we primarily focused on organizational stakeholders. So bringing people that have a big reach, like the Canadian Physiotherapy Association. They represent 20,000 physiotherapists. Or this construction organization that I mentioned with 500,000, that matters to government. But what also matters is individual people writing a letter to their member of parliament, because, I know it's different now, COVID, people aren't having hallway conversations in the chambers of government anymore, but people talk and say, hey, health minister, I've gotten 100 letters from my constituents about the need to move this forward. And that kind of pressure matters. So on the Prioritize Pain campaign page, which is paincanada.ca, also available in French, there are templates like for people to write letters to their member of parliament or to the minister saying how much this work matters and how much you want to see it move forward. So that's just one thing. Being involved in grassroots kinds of groups, coming to things like this, like we track all of these things, like how many people showed up, how many people wrote a letter, how many people tweeted, and that really makes a difference. I see Jen's just put this in the chat. Linda, jump in.
Yeah, I mean, you said everything pretty much, but follow the organizations like Pain BC, sign up for newsletters, sign up for CAPA's newsletter, get that information. We send out updates every month of opportunities of where you can get engaged, where you can participate, and opportunities to get involved in research. Just even something as simple as talking to your friends and family about what's going on. Get the message out there. If you see a post on Twitter or on Facebook about it, share it, and get your friends and families to share it so that we can broaden that reach. Every person we reach matters.
Thank you. I think it's helpful to have the mention of the letter writing because not everyone's on social media, right? And so there's still lots you can do without outside of the Prioritize Pain hashtag.
Yeah, and Jen, I think the other piece, just to Linda's point, you know, when we think about ways for people to be engaged, like there's ways to advocate for the recommendations to be implemented, but there's ways to actually be involved in the implementation. So, for example, there was a big focus in the report on peer support and trying to secure funding for those kinds of initiatives. And I think, you know, where pain organizations exist, whether it's the People in Pain Network or Help Alberta's Pain, CAPA, Pain BC, like where organizations exist that run peer programming, like getting involved there and building the capacity to reach more people through those kinds of peer support mechanisms. Like there's lots of different roles, from kind of directly being involved as a peer support facilitator or as an advocate, or, you know, Pain BC trains people to speak to the media, and we put people in front of the camera to tell their stories. Or in Jen's portfolio in education, we engage people to come and work in our education programs as people with lived experience sharing their stories. So there's lots and lots of ways to be involved, but it often starts with those organizations.
Yeah, and at CAPA now, we're just kind of looking forward to September, which is Arthritis Awareness Month and International Pain Awareness Month, and then National Pain Awareness Week at the beginning of November. I mean, those are great opportunities to get involved. We're going to be doing some Facebook Live and Instagram Live that, you know, we're going to try to reach as many people. And September will be about juvenile idiopathic arthritis and the pain of living with that. And we'll hear from, you know, people, young people that are living with that condition. And then November will be about adults and pain of how they manage inflammatory arthritis pain. So, you know, those kind of things, keep an eye out. And, you know, I know that not everybody's on social media, but, you know, it is, you know, if you find out about webinars and things like that, and you find about opportunities to get, when you get these newsletters when we're working on these things.
Really helpful. Thank you to you both for that answer. Okay, we need to return to the slides briefly. Maria, Olivia is asking us to asking you to walk through the large figure on slide 13. So we'll just take a minute and share that. Oh yeah, it's quite a complex diagram. Is there any way, Maria, is there any way of just sort of zooming in a little bit on the diagram?
I don't know.
I think if you go into view options, you can, you might be able to, oh, actually, that might be for everyone who's watching. Could actually, yeah, everyone who's watching could maybe do that, and then, I don't know.
I'm not sure if I can without disrupting.
Okay.
Why don't I speak to it? And the slides are, like, I'm happy to send this out to people or make it available.
Yeah, because it's quite hard to see. Yeah.
Okay. Oh, you know what? I'm on a giant screen. This is why I like, is that helpful?
No, no, I think maybe if you just go back to it and then speak to, if you can speak, I think it's fine if you just, yeah. And then we can't really see the words within it, I'll be honest, but if you can speak to the layers, that would be great.
Yeah, okay, sorry about that. Sure, so this slide is really trying to convey the 6 goals of the action plan. So from the start, so really trying to prevent, this is the overarching goal, this preventing chronic pain, improving quality of life, and really minimizing the impacts of pain on individuals, families, community, and society. So that's like the center purple sort of bullseye. And then there are the 4 goals that are really more about these levers that Linda talked about. So improving access to care, increasing awareness, the education, and then the specialized training for clinicians around pain, the pain-related research and related infrastructure, so strengthening all of that. And then this piece around data and health system quality. So that's the navy, orange, and the two green things that kind of wrap around the overarching goal. And then the circles outside of that are these things that really cross-cut. So across all of the goals, we need to be thinking about equity. We need to be thinking about populations that are disproportionately impacted by pain. So that's that lighter blue ring. The last darker blue ring is really saying this stuff can't happen without coordination, collaboration, and leadership. So we're really kind of wrapping around this concrete support from the federal government to help drive this change. For a long time, many of us have been working in this bottom-up way. And what we're saying with this is we need to also introduce this top-down kind of support, resources, regulation, all of that stuff, bringing it to the table. Outside of this, all of these little bubbles popping out are representing all of the many actors that we are calling on to be involved. So it's not just the federal government, it's also NGOs, it's researchers and research institutions, it's the regulatory bodies in the healthcare system, it's people who live with pain and peer support and the value of that. It's insurers. So, you know, we know insurers, whether it's auto insurance, workers' compensation, or even the people that provide health and life insurance, they have a huge impact on people who live with pain. So let's get them to the table and engage them, et cetera, et cetera. So this is really trying to create a bit of an infographic that conveys the many people and many things that need doing. Olivia, I hope that answers the question.
Thanks, Maria. That was helpful. Oh, and Olivia says yes. Awesome. And you'll share that slide so folks can have a closer look?
Yeah, absolutely. Yeah.
That would be great. Okay, brilliant. Okay, we have a final question, and this is really around the intersection of pain and substance use. So Dennis is asking, what % of people go to street drugs due to pain?
Linda, do you want me to tackle this one?
Please, I don't know that answer.
Sure. Well, I know related answers. I guess I think the data is less about people going to street drugs. Like, I don't think the data is really clear on that. But I think what we know is that many people who experience substance use disorder or addiction have chronic pain. So the data actually shows really high rates of chronic pain among people who live with addictions. So the data is a little bit, shows a continuum. So there's some studies that show sort of in the 35% to 58%, but I've even seen studies that say higher than that. So we know really, really significant proportion of people who experience addiction also have chronic pain. And when we talk to people who are living with substance use, often people will say, untreated pain is a part of what got me here. It's not that people are saying opioids are what got me here. People are saying the fact that my pain was not treated, and also the stigma that they experience living with pain and the invalidation, the silencing, not being seen as, you know, a legitimate condition. All of that kind of overlays on the experience of pain and can really be an on-ramp to developing substance use issues.
Thanks, Maria. Okay, I don't see any more questions. If you do have any last minute questions, throw them in the Q&A. Otherwise, we will, oh, hang on. Oh, just a thank you from Jennifer. So thanks for your comments. All right. So thanks everyone for attending. We really appreciate you coming today and hearing about the task force report. Linda and Maria, thank you very much for that informative talk. And oh, sorry, we do have one more question. Okay, well, this is good. So Patty is asking, I'll read, it's quite a long question, so we do have time, so I'll read it out. She says, thank you for this presentation and for all this important work. I'm glad to hear that there are plans to mitigate the stigmatization and criminalization of pain. However, I wonder whether the task force has addressed the relationship between healthcare professionals who treat people in pain and the network of institutions, organizations that use medical assessments in making decisions about people living with pain. Given the biopsychosocial model for pain, for instance, the stress of dealing with employers, human resources supervisors, and insurance companies and healthcare professionals can exacerbate pain.
Agreed. And yes, Linda, do you want to start?
Yeah, no, yeah, we've tried to make some headway into some of this. You know, we've been talking to some of the regulatory bodies about reducing some of the stigmatizing language in the guidelines. We've had lots of discussions offline about even the opioid guidelines, the opioid prescribing guidelines that came out in 2017. And, you know, some prominent pain people have said they should be thrown out and start over again. I think that it, you know, the pendulum swung so far one way, and we're working really hard to get it to swing back the other way, and it just takes some time. I think, you know, we've seen some of it happening, but it's not happening fast enough, and there are people who are struggling and who, you know, they rely on opioid medications. And, you know, during COVID, where everything switched to virtual care, I would say probably more than before COVID. And they could go to the clinic, and where lots of clinics closed, and you couldn't go in and get massage therapy or physiotherapy. You know, I'm hoping that with the task force report and with some of the work that's going on, and that we have identified a lot of these issues, that we're going to see things improve. And I'll let you add whatever you think, Maria.
Yeah, you know, it's really interesting to think about these issues, because I think we are seeing some change in this regard. So one of the things that the task force recommended is that the federal government bring together all of the workers' compensation groups in the country, and really look at how, for example, the policy language around claims for chronic pain reflect a sort of outdated view of chronic pain. So they don't reflect a biopsychosocial view. They don't reflect an early intervention and prevention kind of mindset. And really that, like, the science that has progressed in the pain world, like the workers' compensation and other insurance groups that, you know, focus on return to work early and those kinds of things, that they haven't kind of caught up to the science and the evidence. So let's bring those folks together and try and drive change again from the top down through the Association of Workers' Compensation Boards of Canada, those kinds of approaches. And I think that we are seeing some openness. Like, I know here in BC, for example, our Workers' Compensation Board is currently going through a process to re-look at all of their policy language related to chronic pain. And the labor organizations that are part of that, so some of the unions, are really calling on them to heed the evidence and heed the guidance contained in reports like the task force report. So I think that we're starting to see some of that. Again, an example here from BC, our auto insurance organization, you know, previously worked with this adversarial tort model where people had to sue to get the kinds of benefits that they were entitled to, which is a long, drawn out, adversarial, stressful process that can really entrench pain in people's lives. And we've seen a shift there where we've moved to a no-fault model. There's shocking, quite frankly, level of understanding being demonstrated around pain. And our team has actually been very involved in working with them to train their staff and think about how to approach people who've been injured in motor vehicles differently. So I think we're starting to see a change here. And I'm actually feeling a bit more hopeful than I was even a year ago.
Thank you. We just have 1 more minute left. Last question is, are the links in your presentation clickable? Abby's asked for clickable links to any of the organizations mentioned.
I guess I need to go back through the presentation and see what links are there, but yes, we can absolutely direct people to the links if they're not readily visible.
Super. All right. Well, thanks again to you both. Thanks everyone for coming, and I wish you a great rest of your day.
Thanks.
Thank you.
Thanks,
Thank you.
Linda.
Bye.
Bye.